In this surgery, we would demonstrate the crush and chop technique in the most difficult of cases. As you can see, it's a hard hypermature cataract which we have chosen for demonstration here. The corneal tunnel is fashioned in the routine way and a side port incision is made. We will be doing a staining capsulorhexis in these cases. We do it under air. In staining capsulorhexis, we paint the anterior capsule of the lens like a painter paints the wall. In this way, we use lesser amount of stain and can achieve better staining results. Viscoelastic is injected and the main incision is opened up. The capsulorhexis here is achieved with a needle. The pressure inside the bag in such hard hypermature cataracts is very high. So there is a very high chance of the rhexis running off into the periphery. We can see that it seems to be well in control over here, but as probably the AC shallows a bit, it goes off into the periphery. It is indeed at times difficult to control this runoff into the periphery. What we will now do is abandon the rhexis at that point and start off from the other. With a capsule cutting scissor, a nick is made in the capsule and the rhexis is started off from the other side. Now there is a clear-cut threat to this nucleus because we don't have a complete secure rhexis. Any routine phaco technique in such cases may be really difficult. Just a little amount of hydrodissection is done. Such nucleus are rarely attached to the capsule. They can be easily rotated since the cortex has by and large liquefied. Rotation of the nucleus is done. Now the phaco part is begun. We first make a deep trench by sculpting the center of the nucleus right across. The sculpting has to be deepest at the center so that almost 90% of the depth of the nucleus is sculpted. Once this is done, the nucleus is cracked into two halves, much in the same way as we do in a divide and conquer technique, and the two parts are rotated. Now, one of the Sinskey hooks or the crushers is passed behind the nucleus, one in front of it, and the nucleus or the heminucleus is delivered from the back. The crusher that goes behind actually does the job of protecting the PC, and the crusher in front engages the heminucleus and gets it out. Once it is out in the anterior chamber, the two parts are held, crushed and chopped. This process can be repeated as you can see that the heminucleus is very big. Repeatedly crushing it will give us smaller pieces which will require much less phaco power. The phaco requirements can almost be reduced to 1/3 in such cases. Crushing can also be done using the phaco handpiece or the phaco needle. Now the second part is also brought into the AC in the same way and crushed. Smaller pieces are created which are much easier to handle, and dreaded complications like a PC rent or a nucleus drop are avoided. This technique in this way reduces the phaco requirement and the risks. The pieces are easily phacoemulsified and cortical cleanup is easy enough in such cases. The lens is implanted much in the routine fashion, and a potentially threatening situation is managed in a very safe and controlled manner. The utility of the crush technique can also be demonstrated in a difficult case where there is an intraoperative meiosis and the pupil has shrunk to almost an undilated size. You can see that the pieces are being removed with the two crushers, crushed in and then easily phacoemulsified. The pieces are brought out one by one so that the crowding of anterior chamber and any possible damage to the endothelium is avoided. The phaco requirement for removing such pieces is almost a third of what you would otherwise require, and high suction is also not needed. So the chances of holding the iris with your phaco probe and causing damage like iris chapping can be completely avoided. I am not too much in favor of use of iris hooks, as it damages the sphincter and sometimes can lead to permanent mydriasis postoperatively. The last of the pieces are removed into the anterior chamber. Crush, hold, crush and chop is done, and these pieces are emulsified with phaco. Once again, when we were faced with a difficult situation, crush and chop has saved the day. AC cortical cleanup is done and the lens is implanted. We just have to verify that we have actually pushed the lens properly into the capsular bag in such cases. And the surgery is completed safely and nicely. Thank you very much.